Well, thank you all for coming to hear me talk a little bit about, optimizing health before pregnancy, during pregnancy, sort of best tips. And to be honest, I could give like a 5-day symposium on this. Like there's so much to talk about and say. So I really tried to hone down on not necessarily the most important, but I thought maybe the most practical and useful. But certainly, if you guys have questions or if there's other things or whatnot, free reign. So feel free to interrupt me if you have questions, if you want to wait till the end, whatever you want to do. So just to introduce myself, my name is Lindsay Maggio, and I am everybody's neighbor. I live here in Laureate Park. I have a lot of qualifications, which I actually don't like to talk about because I feel like all I do is study and go to school. But my career started with obstetrics and gynecology and then subspecializing in maternal fetal medicine, which is high-risk pregnancies. And I sort of over the last couple of years have shifted a little bit because I only get to see women for a very short period of time when they're pregnant. And they usually don't get referred to me till they're about 20 weeks when there's a problem that's either been identified or whatnot. And so while I love what I do, I was like, well, I really wish I could help women in another way. That's not like, okay, we've got 12 weeks till the end of your pregnancy or 15 weeks to the end of your pregnancy. How can we do what we need to do to kind of get you from here to there? And so I became a lot more interested in like lifestyle medicine and health coaching and just kind of working with people in a much different way than going to the doctor saying, okay, this is what you need, here's a prescription, see you later. Because while there is utility in that, there's a whole lot more to healthcare than that. So I have recently become certified with lifestyle medicine and obesity medicine. I'm working towards board certification with the National Medical Board for health coaching as well, in addition to my OBGYN stuff. So I'm going to sort of just focus on nutrition because I feel like that's a really big piece that there is an overwhelming amount of information about. And it's sort of, I feel like it's hard to parse, like, what do I really need to know? What do I not need to know? Like, there's just so much out there, and what we can focus on as women, just in general lives. And then when we're planning on having our children, after we have our children. And then I'm going to switch gears a little bit into some physical activity and then sleep, because I feel like sleep is probably the most underrated, but as important, maybe even argue more important than some of the nutrition stuff, just because of how it affects everything. So to talk about preconception nutrition is important because there's so many things that we can do with what we nourish our bodies with that can impact our pregnancies and impact our health. We live in a society and in a day and age where we're seeing increasing rates of nutrition-related diseases, so obesity, diabetes, hypertension, and we're seeing these more and more in younger and reproductive age women. There's a theory, developmental origins of health and disease, which we'll talk about it a little bit. I'm going to try not to geek out with you guys too much unless anybody really does want to geek out with it. But it's fascinating that we think that it's not necessarily like our adult behaviors that are creating our risk profile, but that it starts even before that, when we were all in the womb, when we were all fetuses. And for some of us, when we were actually eggs in the ovaries of our moms, when they were in the womb of their grandmothers. So it's 3 generations back, and how what we eat when we're pregnant, and this is not shaming pregnant women at all, so for those there, but really may impact our children and their future. Nutrition also can impact childhood non-communicable diseases, meaning same things, childhood obesity, diabetes, high blood pressure. Nutrition is actually, or poor nutrition is actually a teratogen, or something that we can see is associated with birth defects. And so we'll talk about folic acid being one of the most important micronutrients, that actually making sure that we have enough of that in our diet to reduce the risk of certain types of birth defects. And then it's no surprise, and I don't want to doctor shame because I do love my colleagues, but we don't get this training in medical school. Like, we're only required to have 25 hours of nutrition training in medical school, and only 27% of medical schools in this country meet that requirement. How much nutrition training did you get? Sorry, put you on the spot, Nikki. Huh? None. I think we had like an hour a day for 5 days in my medical school, and that was it. Like, it was very, very minimal. And it doesn't get any better in training after that. In my OBGYN residency, I think none. Certainly not in fellowship. So it really took my own like self-motivation and learning and going through my own life and my own pregnancies and my own health journey and struggle to get to where I am now. And I certainly don't think I have the expertise of like a registered dietitian who really lives and breathes the nutrition stuff every single day, but I'm working on it. So during pregnancy, dietary patterns and consumptions change little from preconception to during pregnancy. So there really doesn't need to be a huge shift once you get pregnant. And then after pregnancy, a couple of small things depending on like, protein and total calories and that kind of stuff. But for the most part, the same tenets for health and nutrition are equally applicable. And so it really emphasizes why it's so important for women to get this education and information ahead of time. And I would suspect most people don't even get that either. When you go to your doctor and they're like, oh, I want to get pregnant. They're like, oh, start taking the prenatal vitamin C later. Okay. I mean, guilty, like we've done it, but there's just so much more and nobody has the time or the space or the place. And so it's just really needed. And why? Because if women can optimize all of these things, we can mitigate these adverse pregnancy outcomes with just dietary changes. If we can have a mom who's got diabetes and get her diabetes under control before she gets pregnant, her risk of birth defects drops way down can be as high as 25, 30% to baseline 3 to 5%. So we really can make impactful change. And these are just some of the pregnancy outcomes that are affected by chronic disease and nutrition-related diseases. So preeclampsia, preterm births, gestational diabetes. So the developmental origins of health and disease really is thought to be caused by an interrelation between genes and the environment. So what we eat, our stresses, environmental chemicals, and how that impacts things. This was initially proposed by David Barker. It was called the Barker hypothesis. And it initially started because he found that lower birth weight was associated with ischemic or heart disease later on in life. But then we also found that moms who had diabetes, their offspring had higher risks of having obesity and diabetes. So we're really seeing what happens during the pregnancy can impact the life of the child. Okay, I just said that. So this is just, let me see if I can pull up I don't think do you see my pointer on this? So this just kind of gives a global overview, but when we talk about the 3 generational effects, so mother first pregnancy, diet, whether or not she has complications during pregnancy, stress, smoking, which I'm not going into tonight, and alcohol, all of these things can impact the reproductive cells of the fetus, which is the second generation, and again, the fetal offspring or mom's grandkids. And it causes all these epigenetic changes, which ultimately can possibly lead to higher rates of these diseases, higher rates of different types of cancers and whatnot. So it's truly fascinating. I hope someday we will have a better understanding of all of this. I still feel like it's talked about, but it's not fully stressed and as developed as a hypothesis and idea as it can be. So I mentioned the non-communicable diseases. And so these are things, like I said, cardiovascular disease, obesity, diabetes. These rates are increased in the offspring of women who have these chronic diseases. And again, starting with preconception nutrition, we really have a great opportunity to try and reduce some of these problems. I mentioned the teratogen, we talked about the folic acid, but even just women who have obesity are at higher risk of having babies with heart defects, specifically heart and spine defects. Alcohol, I feel like most people are aware that alcohol can lead to fetal alcohol syndrome, can actually lead to other sort of less pervasive problems, but sometimes some developmental issues and whatnot. And this is why we don't really know what's a safe level of alcohol in pregnancy. Yes, other countries use alcohol in a much different way than we do, and they don't see some of these higher rates, but we truly don't know, like, okay, if you have a glass of wine a week, is that okay? Versus every night, is that okay? And so sort of the blanket answer is just don't have any, because we don't know what is too much or not, is fine. And then we talked about the folic acid and that association with birth defects of the baby's spine and diabetes. Women who have their hemoglobin A1C, which is the level of blood sugar over the 3 months prior, when that is elevated, they are at higher risk for having birth defects as well. So, okay, so what do we do, right? So we know that we need to make sure that we're eating well and cleaning up our diets and whatnot. But it's like not surprising that it's so confusing. I mean, even our USDA changes their guidelines every so many years. And I actually thought this was fascinating when you sort of look back at the history of their pyramids or their whatnot. So like back in the 40s with their first guide to eating, they had 7 different, here, I'm going to blow that up so hopefully you can see it, but they talk about leafy green vegetables. Everybody always talks about dairy, meat, animal proteins, fruits. So they, they have these big 7 categories. And then in the 50s to 70s, then they started talking about food for fitness, and they broke it into 4 categories: the milk group, the vegetable and fruit group, the meat group, and the bread and cereal group. And just kind of continues as we sort of march through history. This is what it looked like in 1979 with the daily food, the daily food guide, based on the basic 4, but then they added a 5th to moderate the intake of sweets and fats and alcohol. Then in the 80s, we had the food wheel. This was all before my time. It's the next one that I start remembering, but 5 food groups formed the basis for this. The Red Cross actually added a nutrition course as part of the food wheel in 2011. But I think what really damaged a lot, like nutrition in this country, is the 90s, when everything decided to become low fat, which meant everything became high sugar. And sugar is a really inflammatory substance and doesn't do good to our body. But when you look at this, and I'm going to also say, I'm not saying anything is all good or all bad, but we'll get to that. But the very bottom of this is all like breads and grains. And then you come up to your vegetables and your fruits. And then you come up to your dairies and your meats, and then your fats and your sweets and whatnot. In 2005, mypyramid.gov came out. And then this is the most recent one, the Choose My Plate, where they divide the plate into fruits, vegetables, grains, and protein, dairy on the side. And I think we're getting somewhere. Now, the American College of Lifestyle Medicine actually really promotes a whole food plant-based diet. And I think there's lots of merits and benefits to that as well. So this is what their plant plate looks like, their food plate looks like, where one half is all fruits and vegetables, then plant-based proteins, and then whole grains. And they don't talk about dairy at all, because for some people, dairy can actually be very inflammatory as well. And then, there's every single diet. Like, do I do keto? Do I do intermittent fasting? Can I eat vegan? Should I have Whole30? Like, I mean, it's sort of overwhelming. And I don't really think it needs to be that overwhelming, and to just sort of, break it down as simply as possible. And I also don't think there's a one size fits all for anybody. I think there's like general rules. I don't even want to say rules, because when we start restricting things is when our brains start going like, and it's hard to stay within the guidelines of restriction. People talk about macros, like that's a big thing now too, counting your macros, doing all your macro programming. There's all sorts of health coaching out there that do macro programming. In general, this is what the USRDA recommends, that 10 to 30% of your daily intake should be protein, 45 to 65% should be carbohydrates, fats 20 to 35, fiber. I think fiber is actually one of the other forgotten things too, because there's so many, there's about 90% of women don't actually meet the recommended daily allowance of fiber, which is 25 to 28 grams. But fiber has huge health potential as far as decreasing inflammation, decreasing chronic disease and whatnot. So again, guidelines. Micronutrients are also important to remember. And again, we always focus on folic acid when we're talking about pregnancy, because we know there's a direct correlation, but it's important that we're making sure that we're getting things balanced. And for lots of people in our American diets, that balance actually comes in the form of a tablet and a multivitamin, because our diets are just not that great, but it doesn't have to be. Yeah.
What's the difference between folic acid?
Not much in the grand scheme of things. It's sort of how it's formulated, and then there's like different variations, but they all do the same thing essentially when you take them. So like some small chemical bonds and stuff. And then also when we're talking to women who are struggling with their fertility, there's some recommendations out there as to what kind of foods to minimize or avoid or increase. And again, it all boils down to like, what are pro-inflammatory foods and what are not. And for some people, it's different for every person. So a lot of times we're talking about doing like elimination diets to try and figure out what people are reacting to and are not, their bodies are not tolerating. A lot of people look at the FODMAP diet, and which is very strict, but then slowly increasing things to see how your body responds. We know that gut health and microbiome are important, but again, getting it from like understanding the science to practical application, like a lot of it is still pretty limited. But I ultimately think, and this is just me pontificating, there's never going to be a one size for everybody. And so I think we're never going to get to that place where we can say, okay, do this, 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 and everything's going to be good. I think everybody's going to need their own special sort of plan to figure out what their body truly needs. So we know what to increase. You want to increase your omega-3 fatty acids. Vegetable proteins have a lot of benefit to them. Animal proteins can be very harsh and inflammatory for a lot of people. I do eat them personally, but trying to minimize them. Having high fiber carbohydrates, again, increasing that fiber content is going to be really good. We talked about the vitamins, folate, and B12. And then what to reduce, trans and saturated fats, animal proteins, processed carbohydrates, decreasing your deficiencies, and then advanced glycation end products, or AGEs. So these are glycated lipids, so they're fat and protein. So they're fat and protein molecules that we get from cooked food, and they're found they're more highly found in meats and foods that are cooked at higher temperatures, foods that are cooked with drier methods. So like grilling something as opposed to boiling something. We know that these AGEs are associated with insulin resistance, diabetes, polycystic ovarian syndrome, and lower AGE diets improve insulin resistance, decrease oxidative stress, inflammation, and lower weight. So just something else to consider. So I mentioned earlier that for preconception nutrition and pregnancy nutrition, there's really not a whole lot of difference in like the actual recommendation as far as the breakdown of your proteins, your carbs, your fats, et cetera. You definitely need more protein when you are pregnant, and carbohydrates as well. But the overall amounts that we recommend truly are not based in science. They're based on, to be honest, I'm not entirely sure. Somebody once said, oh, this sounds good. And so with a lot of people like doing lower carbohydrate diets and keto diets, the question comes up often like, well, I'm pregnant, can I really maintain my keto, or do I need more? And the truth is we really don't know what's good for pregnancy, what's not good for pregnancy, and how it can impact that. Any questions about the nutrition stuff? I'm just going to sort of parlay into physical activity, because I think this is another one that is easy for people to adopt. I do think language is important, because for a lot of women, when you start saying, oh, you have to exercise, I feel like that can be very overwhelming. But if we start talking about physical activity, for some, it's not as overwhelming. They don't hear that as well. But physical activity is good for women. And then prior to pregnancy, during pregnancy, after pregnancy, like it's just, there are very, very, very few times where somebody really shouldn't participate in any sort of physical activity. And so it does good things for your cardiovascular system. It does good things for your endocrine system and your hormones. It reduces your risk of obesity and other associated diseases with that, and improves longevity. There's different types of physical activity. You have your aerobic, your endurance activities, your strength activities, flexibility, and balance. And so really a well-balanced schedule would include all of these things. The recommended minimum guidelines are to include 150 to 300 minutes of moderate intensity activity each week. And if you do a vigorous intensity, you can cut that in half. And these are minimums. You can do more than that. There's no, with rare exceptions, such like ceiling on exercise. So physical activity is, what you make of it. But strength training is really important for a lot of the previously mentioned things, and doing that at least 2 days a week is important. Just some examples of what's considered moderate and what's considered vigorous, but brisk walking, water aerobics, dancing, light bicycling, tennis doubles. I put that on there. I don't know. I played some tennis doubles in my life that I would probably count more towards vigorous. I guess depends on how intense your tennis is, but Your vigorous activity is more going to be your like hiking, your running, your fast-paced cycling, basketball games, singles tennis. So one thing that's often not, I don't want to say not recognized, but maybe not thought of is this concept of non-exercise activity thermogenesis. And that's pretty much doing anything that you're not doing for physical activity. So parking at the far end of the parking lot, causing, forcing yourself to walk further, doing the yard work around the house, like those kinds of things, they all add up too. So just trying to incorporate movement in any place that you can. So physical activity in pregnancy is also really important. We used to have really antiquated guidelines where we told pregnant women, like, don't get your heart rate above 140, you're, delicate flower, don't do anything. That sort of fall into the wayside. So really whatever your level of activity is prior to pregnancy is completely fine to continue. So if you're the marathon runner and you want to run your marathon, have at it. If you're someone who's pretty sedentary prior to pregnancy, then starting a routine that's a little bit more scaled back and slowly increasing to how you feel. And for those of us that have gone through pregnancy, oftentimes there comes a point in the pregnancy where you're not going to feel like doing as much activity or not as vigorous of activity just because of all the changes in pregnancy. But there are women that run the Chicago Marathon and deliver 3 hours later at 37 weeks. So to each their own. But not only is it good for all the other health reasons, it also helps reduce the risk of high blood pressure problems in pregnancy, reduces the risk of diabetes in pregnancy. If you do get diabetes, which is purely caused by your placenta and not what you eat, it also helps with blood sugar control. It keeps your insulin resistance down and whatnot. And it also helps with pain, disability, and postpartum mood. So most exercises are safe in pregnancy. This is just an example of 6 of them. This is not an exclusive list. Things that we like pregnant women to avoid are things where they could have like trauma to their abdomen. So contact sports, boxing, riding a bike on the road is a little controversial because you can't control the other traffic if you were to get hit, but the act of riding a bike itself is fine. There are certain pregnancy conditions where we do recommend scaling back, like if you're having bleeding in your late 2nd and 3rd trimester. But again, also not based on good science, more sort of like everybody feels better about it. But for the most part, pregnant women can maintain all their physical activity. So the last thing I wanted to touch on is sleep. And like I mentioned in the beginning, I think sleep is, maybe I think it's so important because I'm chronically sleep deprived as a single mom of 2 toddlers, but there's so much restoration that happens in our bodies when we're sleeping, and it affects one of the big hormones it affects is cortisol. When you're not getting enough sleep or getting interrupted sleep, your cortisol levels are going to be elevated, which then impacts your insulin levels, which really truly affects like so many things. So sleep is great, but I feel like it's one of the first things that we're like, okay, all right, well, I just need to stay up another hour because I have XYZ things to do. And it's one of the first things that falls by the wayside. So this is stuff that most people probably know when when we talk about sleep hygiene and best sleep practices, you only want to use the bed for your 2 S's, sleep and sex. You want to eliminate like light, so clocks, TVs. I mean, even on the like alarms or smoke detectors, sometimes those lights, making sure if you have blackout shades or really dark shades, because that light can really impact it. Making sure your room temperature is cool. Our body temperatures do funny things when we're sleeping and sort of really take on the room temperature. So if your room is really hot, you're going to be really hot, which is going to impact your sleep. Minimizing alcohol and caffeine. Alcohol, I don't want to come up here and say don't ever drink alcohol because we all, most people like to do it, but it really, having alcohol too close to bedtime can really interfere with your sleep patterns and whatnot. So how do we improve our sleep? One of the best things you can do is sticking to a schedule. A lot of what people will do is they'll be great about their schedule Sunday through Thursday, and then Friday, Saturday, all bets are off and we get all screwed up, and then we kind of have to readjust to that. Making sure we get lots of exposure to sun during the daytime also helps with our circadian rhythm and our sleep cycles, which fortunately here in Florida, we have access to a lot of sun and we can get outside. It's definitely harder for people who live in areas that don't have as much of an agreeable climate. Maybe I'm imposing that on myself because I hate being cold. But limiting your caffeine, limiting nighttime caffeine as well, avoiding alcohol within 3 hours of bedtime, making sure you're actually getting at least an hour of physical activity a day helps with sleep too. Food choices can help. If you're having a very high carbohydrate meal later on in the day, that can impact your sleep. Snacking after dinner or late night snacking can also affect your sleep. High sodium foods can affect it. Not being dehydrated can affect it. So really, pretty much everything can affect sleep. So in pregnancy, sleep is really hard. There's lots of changes that the body's going through. There's effects from hormones. There's physical effects where you have this like stomach that's growing and you can't get comfortable lying on one side. Your pelvis is uncomfortable. So it really can be impacted a lot. 100% of pregnant women have like reported having difficulty with sleep in pregnancy, and that statistic does not surprise me at all. About 79% report it's because of difficulty with sleep position, and then about 54% is because of insomnia. Pregnancy also, because there's increased blood volume and fluid volume, some women will actually get some swelling in their airway and develop sleep apnea, which is then going to impact their sleep. Restless leg syndrome is more common in pregnancy, sometimes due to like iron deficiencies, sometimes just due to pregnancy hormones. And then reflux diseases also can be problematic for lots of pregnant women, which can also impact their sleep. So pregnant women really have it stacked against them. And like, that's when you need to sleep the most because your newborn doesn't understand that you need sleep. So during pregnancy, if you are having, or when you do have problems with sleep, it's important to talk to your doctor just to make sure if you do have any of these other conditions. Some of them can be fairly easily treated. The sleep apnea, a CPAP machine can help with breathing, which will help with sleep. Restless leg, like I said, if you're having micronutrient deficiencies, just making sure those get corrected. Heartburn can be treated temporarily during the pregnancy as well. Anybody questions about any of that? So I just wanted to just explain a little bit about what health coaching is and what health coaches do, because it's definitely different than what doctors necessarily do. But health coaches are more like partners with you. So when you go to the doctor, you go there expecting like a diagnosis and a treatment often. So with a health coach, you're not necessarily looking for that information, but you're looking for that partner, that accountability person, somebody that's really going to help you get from where you are to where you want to be. So it's really sort of, it's much more I don't want to say self-motivated, but self-driven in that you are defining like what you feel are your health obstacles and your needs and how you're going to get from where you are to those goals that you want to be at. And so this is sort of the pathway that I have taken to help women get to those health goals and reach those health goals, whether it's before their pregnancy, after their pregnancy, et cetera, so that they can make, live the life that they want to live and whatnot. So with my Perinatal Pathways, that's what we mostly option is one-on-one coaching, 3 month, 6 month packages, single sessions, just depending on what people's commitment or wants or whatnot and whatnot. But so that's all I really wanted to talk to you about tonight. I'm happy to take any other questions if you have any.
With the coaching,
yeah.
What's like the baseline? Like, do you do like a blood work panel and kind of see where some deficiencies are and base the program off of that?
Not necessarily, because again, it's like very self-directed. Now, it sort of depends on sort of where you are and where you come in, and if you're primary care, and if there's other things going on. I may need to. I think that's the beauty of like being the physician health coach, is I can like change the hat. So if we're talking and I'm like, maybe we really need to consider that, then absolutely. But that's not the focus of it.
I had a question about nutrition.
Yeah.
What does the science say about caffeine?
So it's okay. You do not have to give it up. Again, it's not an elimination, but a restriction. So the general rule of thumb is like 2 regular cups of coffee a day, about 400 micrograms of caffeine is totally fine during pregnancy. Some of us had a hard time giving up our daily afternoon lattes. It happens. No, but you don't have to stop it completely. And truly, there's not a whole lot of data as to like why it's bad. Yes, we think maybe there's sometimes like the babies can get these little arrhythmias and we tell women to cut back on caffeine, but it's sort of a voodoo. Unfortunately, pregnant women are like a very hard population to study scientifically because they're excluded from so much, which is to a fault, in my opinion, because like nobody wants to be the guinea pig. I get that. Like you're growing your baby, you don't want to like do anything that you think is risky. But then at the same time, when we really need to do something, we don't really know how much is too much or not enough and whatnot. So a lot of what we know in pregnancy is because we identified something and then looked back at all these people and we're like, hey, do you remember how much caffeine you had? And there's always this bias like, oh yeah, I must have had too much caffeine. Like that must have been the reason. And maybe true, maybe not true. So. Any other questions? Yeah, no, go ahead.
I'm very curious about
No,
this.
I made this short so we'd have time to just kind of talk. And
Yeah, because when I think about nutrition and pregnancy, I really just think about like this crazy long list of like, do not do this, like do not eat deli meat, do not eat raw meats, right? Like well done steaks. Like, how much should we really be sticking to that?
so a lot of it's going to depend on your risk tolerance, truthfully, because we are very restrictive in this country as to what we recommend pregnant women can eat or not eat. So a lot of the recommendations are because we don't want you getting certain diseases, like, for example, listeria. So listeria is very bad for developing fetuses. Most listeria outbreaks, like if you read the news, are in like produce. We're not telling women don't eat the romaine lettuce, right? So that's where we say like don't eat the deli meats because listeria has been found in deli meats. And if you're going to eat them, heat them up. I think the overall risk of it is very low. So do I tell my patients don't eat the deli meat? Yeah, if you really don't want to do that. Did I get an Italian sub once a week because that's what I wanted when I was pregnant with both kids? 100%. So same thing with like soft unpasteurized cheeses. Again, that's that listeria risk. People say don't eat sushi or raw fish. In this country, all the fish is flash frozen, like there's nothing in there. So biggest risk would be like parasitic diseases, which would suck when you're pregnant or not pregnant, but that's more just from being ill, not necessarily can affect the baby. I'm trying to think what the other dietary things that were like. So fish, mercury. Mercury, I think, is important. You don't, but there's so many good fish that don't have high mercury contents. So the steaks, like your mahi-mahi or your tuna steaks, those you want to really minimize. Now, you don't have to not eat them at all, but just not having them every single day. But if you love tuna, canned tuna is totally fine to have. All the white flaky fishes are fine to have. So there's a lot of seafood you can eat. And then alcohol is probably the other one. And truly, we don't know. And nobody's ever going to sign up for that study.
Right.
So I don't know if we'll ever really, really know what's safe, what's not safe.
Is that included in your coaching, like just kind of going over general guidelines?
Whatever, yep. It's really individualized. So it's whatever people want, whatever they need, and whatever's going to give them the best success.
You have to do weight loss coaching?
Yep, all part of it. So the one thing I'm not doing right now is like prescribing medications for weight loss. I probably will at some point, but it's a little trickier with Florida and the medical stuff. And it's just not something I've set up yet. But most of those medications too, we also don't know. We don't recommend them during pregnancy. So if someone's looking to get pregnant in the short term, it's probably not the best solution for them. But
this may be kind of silly, but what about just like Advil or Tylenol at some point?
Yeah.
Is that like you had really bad headaches the other day?
Yeah.
Like, you refuse to take them, but I'm just curious.
Well, it was like everything online is just a little freaky. So like,
you can Google it. You can Google yourself down any wormhole with pregnancy and stuff. So Advil falls into the non-steroidal class of medications. And those medications we do know, especially later on in pregnancy, can affect certain openings that should be open on the fetal heart that close after birth, and they can prematurely close if you have lots of exposure to those NSAIDs. So we typically say no NSAIDs in pregnancy, period. The truth is taking them earlier on in pregnancy is totally fine. And there are certain circumstances and indications before 32 weeks where we'll use them to, sometimes they stop contractions, or we'll use them for women who have like degenerating fibroids, which are horrifically painful. But in general, we say try and avoid using the non-steroidal anti-inflammatories because of that effect on the baby's heart. Tylenol is totally fine to use. Now, if you start Googling it though, you'll find that it's associated with autism and it's associated with all this stuff. There's like bad studies that came out that showed, this was, I think it was like 2014, a big study is like Tylenol is associated with like autism or ADHD. And again, it like goes back to the, okay, my kid has this. What did you take in pregnancy? Oh, I took all that. So like, do we really think it's causative? No, not at all. So Tylenol is a very safe medication to take in pregnancy, but it's definitely gotten a badder rap in the last 5 or 6 years. What else?
Any like book recommendations?
So yes, but I'm going to forget, you know her name. Thank you. I was like, yes, I love her books. Lily Nichols has a like Real Food for Pregnancy and Real Food for Gestational Diabetes. And I think she's got great like content even on her Instagram account and stuff too. I was like, I know you'll know her name.
So all the questions you asked about like soft cheeses, deli, she
Yeah.
goes into the science. And it was just so,
That's really good. What was her name again?
Lily Nichols.
Lily Nichols. Okay.
And the book is Real Food for Pregnancy.
Okay.
That's probably the best one that's out there. I think some of the other, I mean, like everybody talks about what to expect when you're expecting. Like I said, a lot of the stuff that we tell pregnant women, not me, has just become like dogma for no good reason. Like, because we've been saying it for 20, 30, 40, 50 years. And we just don't like, again, there's just a paucity out there. But when you really kind of think about it, like, how does this even make sense that this would be an issue? It's like the whole, like, don't sleep on your back thing. Like a couple of years ago, somebody came out with a really good study that showed actually doesn't really cause higher rates of stillbirth. Like, it's okay. Get your sleep, get comfortable. Like your body will move you if it's not working. So that's probably the best one for nutrition, hands down. So I have a sign up list over here if you guys want to get on my listserv. I'm going to do a little raffle for some free coaching. I'll do it on, like, I'll do an Instagram live on it for that. I really don't send out much. I'd like to send out a little bit more. I'm hoping to do like quarterly newsletters with just some like information and stuff. But if you're interested and if you want more food, there's plenty. So you